Okay.
Actually, type 1 diabetes is a very rare disorder. It's actually an autoimmune disorder.
It's rare for
Yeah,
kids?
it's rare for kids. So unfortunately, many think that because of that, it's the fault of the parents or the kid giving too much sweets, but actually it's not. Type 1 diabetes is an autoimmune disorder. So sometimes it follows any illness, particularly viral infection. So your immune system mistakenly attacks your body and your pancreas, destroying the cells producing
So
the
it's
insulin.
not genetic?
There is some genetic predisposition, but usually it's sporadic, meaning it just happens.
It just
It just happens. So unfortunately,
okay. So
yeah.
for the longest time, I thought if your
For the
parents have
longest
it,
time, yeah, many people will think that, oh, because the mom fed too much sugars. Actually, it's not. It's not. It just happens.
Losing out on the lottery, Gina.
Yeah.
Is it reversible?
Unfortunately, it's not reversible. Once you have type 1 diabetes, it's a lifetime disease. So imagine the pain and the journey of the parents living with type 1 diabetes.
Parang si Gary V, di ba, has type 1 na
I
yun.
think, yeah, type 1 diabetes, insulin dependent siya.
Up to how old yung child na parang in danger siya na magkaroon ng type 1 diabetes?
Actually, any age group could be affected by type 1 diabetes.
Any age
As young as infants, sometimes you get kids with type 1 diabetes. But most commonly it happens between 4 years old to 7 years old. It's the most common age where kids get it. So it doesn't discriminate on age or gender, so anybody can get it. And it just really happens.
What symptoms should parents look out for?
Okay, so most of the time, kids will present with increased thirst. Yung inom ng inom,
weight
more
loss,
than the
no?
required fluid intake. Tapos, syempre dahil inom sila ng inom, iirin sila ng intake. So those are the two most common signs. And sometimes they also get unexplained weight loss. Ang takaw nila, they eat too much, but they're not gaining weight, and they're losing weight. And then of course, they feel fatigue, and sometimes you also have blurred vision. Because the pathology is the body cannot make use of the sugar in the blood. It stays in the blood, but your muscles, your tissue is not using it. So the fat and the protein in your muscles being used up as a source of energy to kids. And unfortunately, some kids come to us as emergencies because the parents.
Yung color po ng P, wala namang anything to watch out for. Yung color ng P.
Color ng pee, there's really nothing
normal
to watch out.
lang.
Pero minsan yung mga ibang parents, at napapansin nila, I have experience na may ihi sa toilet bowl or sometimes
May
even the
langgam.
underwear, biglang may mga ants.
Yeah.
So then sometimes you can also notice it because when you have
But the
high blood
appearance
sugar-
is normal.
Yeah, the appearance is normal.
So Doc, is it automatic that if your son or daughter has diabetes, type 1 diabetes, automatic insulin agad?
Yeah, insulin. Kasi they cannot produce insulin. So you really
That's
have
for
to give
life.
insulin. Yeah, for life. So imagine the routine. Most of the time, we encourage children to take their blood sugar before eating and before sleeping time. So how many times a day? That's 4 times a day. Diba? Buti na lang, they have a continuous glucose monitor now, which they attach underneath the skin.
Freestyle.
Pero every 2 weeks, you have to replace it also. It's very expensive. I think that's 2,500. So, kung mahirap ka, magsatsaga ka sa puso. And sometimes, the prick itself can cause infection.
Yes.
Diba? And of
Kasi
course,
open.
the pain. Ako nga, ayoko. Gusto ko ako sa surgery.
But you know, Doc, all the symptoms that you mentioned kanina, those are the things that's easily overlooked by a parent, right?
True.
So parang, so what usually happens, parang is there a test prior, parang, I don't know, prenatal test before or
There is no, we cannot identify any risk factor that will categorize the child as high risk for diabetes.
So it's not true na if type 1 diabetes, born with it. It's not true.
It's not true.
Usually it can follow any viral infection like mumps, measles, even dengue, usually postviral.
For the longest time, akala ko.
So, really, diba, ang daming misconception. Sometimes most parents are blamed because it's not child's condition and not understanding that it's not their fault. It's no one's fault.
how about COVID?
Yeah. Any viral infection actually, or any infection can trigger an autoimmune disorder. But most of the time it's associated with viral.
What are the signs parents should watch out for?
Yung increased urination,
Thirst.
increased thirst, fatigue, tapos unexplained weight loss, blurred vision na cannot be explained.
Doc, yung blurred vision, pag napabayaan yan, is it irreversible?
There are different types because when we speak of diabetes, there are different pathology why we get blurred vision. For kids with type 1 diabetes, the lens, the sugar goes to inside the lens, tapos it absorbs water, so it makes the lens thicker, causing blurry vision. But there is also a chronic disease which is called diabetic retinopathy. So it destroys the retina. It's irreversible if you don't monitor it. So if you have child with diabetes, dapat monitor nila yung retina, inside the eyes. Dapat meron ding regular check-up without conditions. Even for adults, actually it happens. And kapag you fail to catch it early, it's irreversible. It's irreversible.
Gano'n po ba common yung type 1 diabetes here sa Philippines?
I don't have any data for. I'll check it out later. So
Like you mentioned earlier, it's kind of
rare.
kind of
rare.
rare. It's not so common.
But do you have statistics, Doc? How many Filipino kids are diabetic?
I'll check later.
Is there a special diet that they should follow?
Actually, we encourage high fiber diet, low carbohydrate diet. That's what we want. And of course, low fat kasi so most of the time we think diabetes is just about sugar problem. But most of the time, this will have comorbidities like hyperlipidemia, their cholesterol, triglycerides also increase sugar. So you really have to be very careful. So it's high fiber and dapat good protein the diet, low carb diet.
In terms of activities, are there limitations?
Actually, that's what we want to say. There are no limitations to the physical activities they can do, but they have to check their blood sugar first before doing any physical activity because if their blood sugar is down, then it will really hamper the physical activities and it could cause hypoglycemia, which is dangerous. Hypoglycemia can trigger seizure.
Because the child has to deal with it until he grows up. Like, what are the management besides the diet and the insulin?
Basically, that's it.
That's it.
Insulin talaga is the mainstay of therapy. And emotional support is important. Some kids and even parents stop.
Kids kasi don't understand.
And then financial constraints. And of course, the pain of doing the prick. Diba? And of course, sometimes it's just caregiver fatigue and sometimes patient fatigue and taking care of oneself. It happens. It happens.
But if you follow this, the child can grow relatively normal.
Yes.
Oh, that's good at least, diba? No physical activities na bawal.
Wala naman.
That's good. That's good.
Pero mahirap talaga siya. It's very
Pero Doc, mahirap kasi kagaya ng sinabi ba, di ba? Yung mga symptoms na yun, ma-overlook eh. So, I have a friend.
As medical emergencies, kasi when you fail to recognize, it's kasi patients who are insulin dependent, the body has a tendency to use your fat
Yes, keto
to
parang
make,
ano.
so nagkakaroon sila ng diabetic ketoacidosis, increases keto productions in the body, which result to acidosis, then sometimes it results to immediate coma in children. So, hirap, sobrang hirap. Sometimes the symptoms are so vague, it's not specific, sometimes it's easy to miss it. It's very easy.
Kasi kids play, so they get tired, they get thirsty. They lose weight.
Akala mo malikot na, akala mo.
Look, even infants, they have.
Yeah, they can.
So this thing, hindi siya nade-detect ng ano, newborn screening.
No, diba? Saka it can just happen, so you wouldn't think that your child will have diabetes.
Di ba parang could excessive bedwetting be a symptom? It can po, di ba? Kasi inom sila ng inom.
Yeah. So if you have a child na excessive bedwetting, tapos pagkita mo sa kama, lagi may langgam, dapat medyo watchful na mo sa baka diabetes.
Sorry, last. How about the diet of the pregnant mom? Does it affect?
No, not really. It's also
Just
Yeah, for
happens.
good.
Now we want to emphasize that it happens, nobody to blame. Nobody wants the diabetes. Nobody is to be blamed for the diabetes.
Thank you so much, Doc.
Thank you, Doc.